Well, this Friday is National Wear Red Day, a day to kick off American Heart Month and a time to raise awareness about heart disease and strokes that affect millions of people every year. The day is also shedding light on the importance of learning CPR to those who may be suffering from cardiac arrest. We hear lots about this in the news. Joining us to talk about National Wear Red Day, Dr. Edith Jones-Poland. I see you once a year because we're always talking about the importance of awareness when it comes to heart health.
Yes.
So thank you for being here. Why is it important for everyone out there to learn CPR?
Well, the majority of episodes of cardiac arrest actually happen outside of the hospital. And so if a person learns hands-only CPR, it increases their likelihood of surviving by 2 to 3 times.
Wow.
Yeah, so we're asking that one person in each household learn hands-only CPR.
Okay, and we know that there are certain signs, and they're different for men and women, that lead people to realize that a heart attack could be happening. Could you talk a little bit about what those signs are?
Yeah, so women and men typically experience chest pain. So it's chest pain that can be like a crushing sensation, often associated with shortness of breath. They can have a sensation of pain that goes up into the neck and down into the arm. And that feeling of a pressure, they say like an elephant on the chest.
Okay,
women,
heaviness?
Heaviness,
Yeah.
a heaviness on the chest. And women can also experience symptoms of nausea. So where that's a little bit different than how men experience it.
And as I've realized through the organization that women, especially in their mid-40s or 40s, are prone to heart attack. It's the number one cause of death among women.
That's
so this is something we really do need to focus on. So let's talk a little bit about CPR and the importance. We have our demonstration here. I don't want to call it the dummy word, but
I think she's CPR Ann.
Okay, Ann. All right, so Ann, it's a lot more simple than people think, right?
Right.
Can you do a little demonstration on CPR, or what people tell us what as you do it, what needs to be done?
Absolutely.
Okay.
So the most important thing to do is call 911 right away.
Okay.
So when somebody is unresponsive and you think you're going to need to start CPR, call 911. That way you can get help coming immediately.
Okay.
And then the next thing that you want to do is start applying pressure to the chest. So what you do is just look for the little curve in the chest, sort of right in the middle.
Oh, in the middle.
Right. So right above that curve is where your heart sits.
Right.
You're going to put your 2 hands together so that they are on top of each other. You want to keep your arms straight. So you don't want to be going like this. You want to keep the arms straight so that you get pressure straight down. And then you want to be going quickly. So you're thinking of a song to a beat, like Staying Alive, something like that. So you're quickly putting pressure.
And harder than you'd think? I think people would be timid because they'd be scared of breaking bones, but you want to put that pressure on,
You want to put a lot of pressure,
right?
and actually research has shown that women are less likely to receive CPR because of the concern about putting pressure on the chest. So that's why it's so important for everybody to learn, one person in the household. So right here on the chest, pressure just like this, quickly. And that will help to oxygenate the body.
And you do that for a minute straight, or until you sense
until you
some
get help.
signs of life coming back to the body?
You keep doing CPR until the paramedics arrive.
Okay.
Obviously, if the person becomes responsive, you would stop.
Then you stop.
But otherwise, you wait, and as soon as the paramedics come, they will take over. But otherwise, you keep doing CPR.
Wow. It seems like it would be such a scary situation and a judgment call. I mean, I just picture myself and my husband collapsing and what I would do. And, you know, I mean, a lot of people's natural responses is to step back. But you're saying jump in.
Assess the person. Of course, you can check to see if they're breathing and if you're feeling a pulse rate. And that's why it's important to call 911 immediately, because you may not be an expert. And as soon as EMS gets there, they can take over.
Okay. And some people are worried that it's too hard to go through the training, that it's too difficult, but it's not. It's something, as you just demonstrated, can be done fairly simple. Is there a link or a website that people can go to get more information? Or
Yes. So it's, I believe it's cpr.heart.org is the website for CPR. The American Heart Association has all of the information. Actually, CPR is incredibly simple. It used to be a little bit more complex with the giving the breath.
Right.
But now with the hands only, it's extremely simple.
Okay. And we have events coming up this month. We are wearing red on Friday. It's National Wear Red Day. And we also have the American Heart Association's luncheon that we do every year.
Yes.
And we'll both be participating in that as well.
Yeah, it'll be a wonderful event. I love it. It's my favorite time of year.
Same with me. All right. Thank you so much. There we are. We're seeing video from years past.
Previous years.
And as you see, plenty of women. I mean, it's always surprising to me how many many people come out. And I think because there's so much education there, we have doctors on hand like yourself to talk about situations and enjoy a heart-healthy lunch.
Yeah, it's a really great event. It's such a wonderful event to focus on women and such an important condition that can affect their lives.
All right. Thank you so much for being here with us this morning. And we're going to turn it over to Jerry to get a little bit on the weather. Jerry.
Yeah, a little gloomy yesterday with all the clouds. That's cleared out, so plenty of sunshine this afternoon. Dry air in place, but still a little cool today, but those numbers will start moving up. We'll take a look at the full forecast next.
Great. Good to see you.